Chedijin Kaur brought her niece and nephew to get their shots before they start school. Because the teenagers just moved here from India and are uninsured, they came to the city-run health clinic, Corona Health Center.
Really, people need that help because for the school, when they have to go to the school, they really need vaccinations. They cannot start the schools.
But by the end of the month, the health center will no longer offer immunization services.
It's ridiculous. I wish they would rethink that.
City Councilman Daniel Dromm says he's been writing to the City Department of Health in protest.
Not having those immunizations is really going to harm our low-income immigrant communities that live here in this neighborhood.
The DOH says not many people are using these clinics for vaccinations. They only get about 1% of all adult vaccinations in the city. More than 40% of their patients are insured. Those patients are going to other locations for their immunizations. And because of extensive budget cuts, the DOH had to scale back on services where alternate providers are available. Even though the health department says STD and other services will continue at the center, Dromm says he's heard the entire center might close down. He says that would be a blow to his constituents.
And Elmhurst Hospital is overwhelmed. So the work that they do in that clinic is vitally important to our community.
Dromm says this clinic saw more than 7,500 patients during the first 6 months of this year. The center's only open twice a week. Sarah Cruz brings her twin 1-year-old girls to the Corona Health Center.
Here is good for me because you see the Elmhurst Hospital is low for me.
The only other open city-run clinics are in Brooklyn and the Bronx. In Corona, Agnes Chung, New York 1.